Hey, Sam here from Rehab United to talk about overhead athletes, common injuries that we see, and ways to treat and prevent those injuries. Today we are going to start a series discussing the mechanics of the shoulder through the demands of the overhead sports. The glenohumeral joint is known for having a lot of range but poor stability, which can lead to dislocations, muscle tears, or labral tears. Our shoulder is held together by ligaments, the labrum, and muscles which all must work together with proper timing to achieve proper mechanics. In volleyball, we see a lot of times that they only warm up the shoulder, which leads to poor incorporation of the hips and the mid-back, which increases demand on the shoulder joint. Now, let's get into sport-specific movement and potential injuries. In volleyball, one of the most demanding movements is hitting. The player must approach, line their hips up with the setter, jump, rotate through the air, and make contact with the ball through a powerful arm swing, frequently using medial and lateral chopping motions to change direction of the ball. This requires forceful muscle activation in end ranges of shoulder movement. One common limitation we see is lack of thoracic rotation in their approach. So hit after hit, they stress the shoulder, leading to injury. A second limitation we see is lack of hip extension in the jump. This also leads to lack of thoracic extension, again, increasing demand on the shoulder. To treat shoulder pain or injury here at Rehab United, we will always look at the whole body, not just the symptomatic joint. We will assess thoracic motion and hip mobility in all three planes while standing and during the whole approach, swing, and follow through. However, if you can't make it in to a visit with us here, go ahead and check out these exercises to treat your shoulder pain at home. The first stretch is a three-way pec stretch. Start with your hand high, then move to middle, and lastly, move to low position to get all angles of the pec muscle. Next, we have a kneeling hip flexor stretch with a three-way reach. You will reach overhead, rotate right, and rotate left to incorporate upper body and thoracic mobility. Use this dynamic stretch to again open up the hip flexors and increase thoracic rotation. Be sure to reach upwards with the same arm as your front leg. Last is a dynamic squat to open chest and arm back, mimicking your hit in order to more functionally prepare you for practice.